Hello, I am Dr. Edna Maro, specialist in human reproduction and biology and medical director of the Fertility Center. October is the month of awareness in breast cancer, and in this month we are going to have a lot of information regarding this topic. In this video, I would like to make the awareness on the importance of diagnosing this disease, as well as to guide people and women who have been dealing with this problem. We will guide you to the process involved in preserving your fertility after you have finished with the treatment, the options that we have, and how we can prevent this disease. When one of our patients asks us that they want to have children after they finish with their cancer treatment, usually it takes time to planning. First of all, at some point we are going to talk about fertility preservation, that usually involves the preservation of eggs, sperm, or tissue that may be used in the future. The most common mistake is think that fertility preservation is only intended for patients with infertility, but actually this is not like this. At some point after you have finished with your cancer treatment, probably you are going to have in mind the idea of having children or family. So, at some point, you may need to start the conversation. Most importantly, because the treatment for cancer sometimes may produce temporary or permanent effects in your fertility capability. In LIVE, these are all our options for patients that are dealing with cancer and need to postpone their pregnancy. Also for patients which are dealing with infertility, or finally, for patients that have already finished their cancer treatment and want to start planning their pregnancy. Embryo freezing or embryo cryopreservation is an effective way to help preserve fertility for women. Mature eggs are removed from the woman and placed in a sterile laboratory dish with several thousand sperm. The goal is for one of the sperm to fertilize the egg. This is called in vitro fertilization. IVF-ICSI, or in vitro intracytoplasmatic sperm injection, involves taking a single sperm and injecting directly into an egg for fertilization. In both options, the laboratory dish is observed, and if the egg is fertilized, the embryo can be frozen. Then, once the treatment is finished and the patient is ready to try to get pregnant, the embryo is thawed and we put it back into the patient's uterus to try to achieve a pregnancy. Egg freezing or cryopreservation of ovocytes is also an effective way to help preserve fertility for women. This may be a good option for women who are single, do not want to use donor sperm to produce a fertilized embryo, or have a religious conflict with freezing a fertilized embryo. For egg freezing, mature eggs are removed from the patient and frozen before fertilization with the sperm. This process is also called an egg bank. When the patient is ready to try to get pregnant, the eggs can be thawed, fertilized with a sperm from a partner or a donor, and implanted in the uterus to try to achieve pregnancy. Using donor eggs. It is an option for women who have a healthy uterus and who are authorized by their doctors to carry a pregnancy, but who cannot conceive with their own eggs. The process also involves IVF. The donated eggs come from women who volunteer to go through a cycle of hormonal stimulation and have their eggs collected. In our clinic, we can direct you to a 100% reliable organization to give you the necessary follow-up. The success of your egg donation depends on careful timing of your hormone treatment in order to prepare the lining of the uterus, if it's safe to do it so that you are ready to place the embryo inside. The eggs are extracted from the donor and fertilized with the sperm. The embryos are transferred to the recipient for pregnancy to occur. Ongoing hormonal support may be needed until the placenta develops and makes its own hormones. Many risk factors are beyond your control, such as being in a woman and natural aging. Of course, if you have a medical background in your family with some relatives affected with any type of cancer, and most importantly, breast cancer, you are going to have a very high risk. However, you can still have some changes in your lifestyle in order to reduce the risk, such as losing weight, quit smoking, and perform a physical examination regularly either by yourself or by your OB/GYN. If you have been diagnosed early, never lose hope. If you have been following the instructions under treatment, it's a good factor and a good idea to still continue your life in the long term. This will show you that every struggle will be worth it. And at the end of the way, there is no mountain so high or a valley so low. Receive a lot of strength from all of us and lots of love. Remember that every struggle is going to be worth it. Thank you for watching all of our videos and receive lots of greetings from the most friendly and beautiful beaches from Mexico, Puerto Vallarta. Bye!